strong believer in the separation of church and state. But in this with regard to your recent controversial statements about the poor, when you quoted this, you twisted it in what I think is a very significant and meaningful way. You said that your citation of your passage was that the poor will always be with us. Okay, and what you've done is taken Jesus' words and turned them into a political and an economic statement about poverty, assuming that it lasts forever and it will always be with us, and as though it's, poverty is something created by God. Okay, and in doing that, you let yourself off the hook for the poor people that you're talking about.
That is not who I am. That is not who my family is. I have never turned a patient away based upon their ability to pay. I've made such a lifetime of helping people in need. The only obstetrician in 80-mile radius of Great Bend to take every Medicaid patient, to take every person that couldn't afford health care. And what I meant by the poor people not using health care is they won't use primary health care. They tend to end up in our emergency rooms.
You're judging them. You're judging poor.
They don't have coverage.
They don't have free.
Only 1/4 of the patients we see in our emergency room in Great Bend have true emergencies. 3/4 of them are Medicaid patients or people without monies. So I've done free clinics my entire life at the health department, family planning clinics, pap smears. I've overseen 3 county health departments. I've set up a prenatal clinic in residency where half of the patients in St. Petersburg, Florida were not getting OB care until I set up a free clinic that residents oversaw. So I made a lifetime out of helping people.